Hello and welcome to Dr. Poonam's vlog, and today is our next video in the series of Safe Motherhood series that we are doing presently. And today we would be talking with Dr. Sophia Rodriguez, who is President of Indian Medical Association, the Bardes branch in Goa, to which I am the secretary, as well as she is a renowned gynecologist working for Manipal Hospital, Donapal. So Dr. Sophia, welcome to my show.
Hello, Dr. Poonam.
Yes. So today in this Safe Motherhood series, I want to talk about what to do when I go for the labor. So, we can call it a labor story today. So yesterday we did what to expect when you're expecting. So this was during the time that I'm expecting. Now I'm already 8 months pregnant, 9 months pregnant. I'm almost near my delivery time. I want to know what all things to be done during this time. Okay, so I will be asking you in a question format. Let's have it in a question answer format. So the first question is, I am ready for my delivery. What should my delivery bag contain?
Okay, what the mind doesn't know is what you will not know. So you have to know these things. How to be ready for your delivery or how to be ready for labor. So you need to keep your bag ready. There are two bags. One is the mother's bag and one is the baby's bag. Okay, the mother's bag basically and the baby's bag both have to be ready right from the 8th month of pregnancy, because you can go anytime in labor. So don't do it as a last moment habit. See that the bags are kept in the car or in a vehicle where you will be traveling to the hospital and not at home, because you never know when it can happen and start. Now the mother's bag should have certain vital or important things. These things include disposable panties, a lot of sanitary pads, cotton nighties or gowns which should have side slits, so it's very easy for you to open the zip and feed the baby. For the baby's bag, I think Dr. Poonam will just brief us on the baby's bag.
Yeah, so for the baby's bag, please see to it that you carry white color clothes for the baby. Many times we find colorful clothes brought for the baby and which are dark color, which are not required. So you can buy maybe a light color or white color is the best. Also, the clothes should be pre-washed so that we are not putting the brand new clothes to the baby, because of which babies may get rashes and all other stuff. Plus, you require the baby cap, the putties and the socks for the baby. Definitely, you don't require soap for the baby, which many of them get. You don't require powder for the baby when the baby is born, as well as you don't require the umbilical belt or the tummy belt, which many of them get. We don't require that also.
A very important thing, Poonam, that I would like to highlight is please keep your file ready. Your file at the time of coming for delivery has to be ready, and I would say preferably 2 files. In one file, you please put the doctor's examination findings. File it properly, not as loose papers lying all around. In order of dates, the oldest one down, the newest one up. The second file should have the reports with the oldest reports down and the newest one up. So it's very easy for the doctor at the time when you're going to the emergency to have a look, and not a last moment, where is this report and where is that report and what has happened in the past. With one glance, the doctor should understand everything from your blood group to all the other reports. So that is very important, that file has to be there in your car or in the place whenever you're going to the hospital. So this is a very, very important thing.
So with this, it reminds me of one point. Many patients feel that doctor knows everything about me. So remember one thing, along with you, the doctor has multiple other patients also whom they are looking after. So keeping your file properly makes it easy for the doctor to see it at the glance. Otherwise, we know how it is, papers flying when the patient comes in the labor, which we also don't like. Okay, so it would be best if you can file your papers and everything in a nice, tidy and organized manner, so that everything goes organized. Yes.
Secondly, when you're coming for labor, see that you have a bath and calm. Okay, see that your private area is either shaved or trimmed down, so that either you are not comfortable or the staff over there may not be comfortable at that point of time. So this is very important. One more very important thing is, please have a look at the hospital that you're going to, the labor room, the wards. Be familiar with the place, what to expect, because when you don't know what to expect, then you don't want a surprise towards the end. Also, when you're going to your doctor, please place your trust and faith in the doctor that you're going to, because it becomes very easy for both the doctor and the patient when you have faith and trust in your doctor. If you don't have that faith and trust, it becomes very difficult for us to explain and for you to get convinced in us. And if at all there is a trust issue, please change your doctor. No, we are very open to it, because it is very important that you place your trust in your doctor.
So coming to the next question, what to expect once I reach the hospital?
When you come to the hospital, supposing it is the routine time of the doctor, that's between 8 a.m. to say 5 p.m., you will usually go to the OPD of the doctor. But supposing you are not able to contact your doctor through a phone, you please straight walk to the emergency of the hospital, which is very important. Do not keep calling the doctor on the phone, because the doctor might be busy with something or the other. It is better to walk into the emergency of the hospital, because somebody or the other will then contact the doctor to get to you over there. So this is one very important thing. Secondly, the doctor will first come and check you, okay? All the various vitals, that's the pulse, blood pressure, and the basic examination findings, whether you are gone into active labor or not. There is many times that we get hassled with one or two pains, and towards the end we come running and rushing to a doctor. That should not be. Just please wait and observe your labor pains at home. What is labor pains? Any pains that are increasing in frequency and intensity, these are labor pains. Okay, not just 1 and 2 pains and you start coming running to the doctor. When do you report? When you have labor pains, that is with pains of increasing frequency and intensity. Number 2 is when you start leaking. Leaking is not, it's like water will be pouring down or your underwear will get wet. This is called leaking. That is when the water bag bursts. Third is when there is bleeding, and fourth is when there is less baby movements. This is very important. What is less baby movements? Is movements that are less than 10 baby movements per day. Now, I always trust and believe in my mothers more than the reports, because the mother will come to know first, because the baby is in the mother's tummy. She knows how the baby profile in movements is. So this is what you have to remember, is less than 10 baby movements in the whole day, or in any 2 hours straight. If there is absolutely no movements, that's when you need to report to your doctor. So this is when you need to report. Okay. When you come, the doctor will first examine. That's called internal checkup or an examination internally, to see whether you have gone into active labor or not. Accordingly, the doctor will first admit you to the ward or straight to the labor room. They will also give you something called as enema, which is nothing but to empty your bowels or to empty the stools or lighten up your bowels, so the delivery eases out and the stools don't come in the area of the delivery near the baby or when you are delivering the baby out.
Okay, so this was a very, very practical this explanation, and let me tell you all, in this series we are trying to take those simplest information towards you, or maybe the commonest things which patients don't know. We want to go to that level of information, and we are not trying to give you hi-fi medical information. This is what you are going to do when you are going to the hospital, what you are going to expect when you are going to the hospital. That is what information I wanted to bring out. Okay, so Dr. Sophia, the next question is, I want you to tell the patients what to expect during my labor, because me being a pediatrician, whenever I go to attend deliveries, I find many mothers are shouting at the top of their voice when it is not required. They're actually wasting their energy. So what would you tell about this?
There are various things that a mother requires to remember and mentally prepare herself. The first thing is to hydrate yourself well, drink plenty of fluids, because labor itself causes dehydration. The second point that I would say is listen to calm music or any music which you love. Do not shout on the top of your lungs, because you are simply wasting your energy, and when at the time of pushing the baby out, people are sleeping and they have no energy to push out the baby. I also encourage the husbands to stay with the mothers so that they can help them mentally cope up with labor. At the time of pushing out, you need to breathe in and out nicely. Breathe in through your nose, breathe out through your mouth.
Can
And
you
please
just
breathe in.
demonstrate it?
So
the way
breathing in is this, and not shouting by holding your breath, because stress hormones itself is a big problem to everybody. Okay, when you're pushing out, please do not push out till the doctor does not tell you to push out. Okay, and the pushing action has to be done at the time of active contraction, when you're having a contraction, and not in between contractions, because we are just wasting our energy doing that.
Dr. Sophia, what do you mean by contraction? How the mother will come to know?
Contraction is basically when there is hardening of the uterus, as though your uterus, hardens out completely, so that there is pain basically, and at that point you need to push out.
Yeah, so what she means by harden is actually you will feel something becoming very hard in your tummy. I mean, I'm telling this with my own experience. I had 2 normal deliveries. You'll actually feel that hardening. The moment the hardening is there, that is the time all this energy that you have conserved by not shouting, you're going to push out at that time.
And the pushing action should be as though you're passing hard stools. The way when you're constipated, you push down, it's the same pushing action.
Yes, so that's about what to expect during the labor. So Dr. Sophia, now I have given very good push and my baby is almost reaching at the floor. I mean, my doctor told that yes, the baby's head can be seen. Now, what is done at this stage for my baby to come out?
At this stage, normally a doctor will give something called as an episiotomy in technical terms, but in simple terms, it is nothing but a small cut that we give near the vagina, basically to help the baby to come out easily so that it does not tear the other organs in the surrounding. That's called an episiotomy. Please expect that to happen, but it's not necessary that all mothers get. There is also something called as painless labor, which is very important, that if you feel that you cannot tolerate your labor pains, please ask for an epidural analgesia with the doctor if there's an option there.
Okay, so expecting an episiotomy, that is cut at the bottom, okay, it's not something abnormal, right? It is normal.
It is normal.
Because why I asked you this is many times on 7th, 8th day when the mothers come to our clinic in the pediatrics, they will say, oh doctor, I'm having a cut at the bottom, I'm not able to see it, and all this. Because see, this is something which is normally expected in any mother who is undergoing a normal delivery. So you should be ready mentally to cope up with all this, right?
Some things which can decrease the pain are using an air pillow or a soft pillow. The pillows which we get inflatable in the railways, you can use those, or the soft pillow where you can sit over that. So something called a sitz bath. It's a broad bucket. You put warm water, you can put KMNO4 or potassium permanganate or betadine solution. Sit in it twice a day post delivery. That will ease the pain. The stitches that we put are not removable stitches, they are dissolvable stitches. They will fall down on their own over a period of say 4 to 6 weeks, so nothing to worry about that. You will be able to pass your stools, urine, everything normally. If you have a problem in that, you should consult with your gynecologist and please report the same.
Okay, Dr. Sophia, I did my good job. I had a very nice push and now my baby is come out. What do you expect after that?
Usually we encourage the husband also, if they are interested in cutting the cord. We cut the cord. Then we encourage something called as kangaroo mother care, where they will clean the baby, the pediatrician will check the baby if everything is good, and then the baby will be directly handed over to the mother to encourage the touch and to encourage breastfeeding. Something called as colostrum, which gives a lifelong immunity or gift to the baby. That is, the first milk should not be thrown out. Please feed your babies with the first milk. That is very, very important for us.
So actually colostrum is also called the liquid gold, and it actually stands by its name because there is nothing as costly as the colostrum that you can give to your baby. So Dr. Sophia, now I have delivered, my baby is in my hand, but at the same time I am feeling some stitches at the bottom. Okay, do these stitches hamper my way of breastfeeding, my going to the toilet for pooping and peeing myself? Okay, do they affect my walking around in the room? I mean, if I am normal delivery?
They should absolutely not affect. Little amount of pain is expected. Painkillers are given to you. For the first 48 hours, there will be some pain, but if it is unbearable pain, you need to report it. You also need to feed your baby exclusively for the first 6 months when you are breastfeeding. Exclusive means I think Poonam can tell us. Exclusive
Yes.
means there should be nothing other than breast milk, not even water. Okay, and very important thing that I see is people are having wrong feeding positions. Maybe we should have a separate lecture for
Yes,
this
so
feeding
on
position.
this,
This is very important.
yeah. So for the breastfeeding itself, I'll be having an entire one video on that that will be shot by me. So stay tuned because there are many more topics which are coming up. So I think yeah, that's it, Dr. Sophia. You've given a really beautiful and a practical approach towards my delivery, which may be coming up. Okay, not that I will be delivering now, but still. Whichever mother or whoever is watching me who is pregnant and is expecting a delivery in another few days or months to come, yes, definitely this is what you are expected and this is what is expected from the doctor also, that Dr. Sophia told. And if you are expecting mother, please see to it that you share this video to all other friends of yours who are also expecting. Okay, so that's it, and stay tuned for tomorrow because one more topic is coming up which will definitely help you practically. And Dr. Sophia, thank you so much for coming up on my show and giving such a nice practical approach towards my delivery.
Thank you, Dr. Poonam.